From across Maryland, Virginia, and the District, this is Washington's 24-hour local news leader. News Channel 8's Live This Morning starts right now.
There's a medical practice in Northern Virginia where the doctors actually answer their own phones when somebody calls. We've talked about it before, and Dr. Steve Simmons is back now to talk more about the everything old is new again approach to medicine and how we've cut the middleman receptionist out and provide better care in the process. DocTalker is the name of the organization.
Yes.
Good to have you back, Dr.
Thank you for having me back.
Getting a phone call from your doctor, that doesn't happen much these days, does it?
Well, it does for me. And also we answer the phone when our patients call, or we call them right back. We don't have a receptionist. We want our first chance at triage.
But people are going to say, how can you do that? Because if you've got patients in there, they don't want to be interrupted when you have to reach over to answer the phone. Do you have certain times of the day that you're available? How do you do that?
Well, what we do is we try to have someone answering the phone and someone in the office, and ideally someone running house calls, which would be 3 people clinically working in a day. And it makes a big difference if you get that phone call.
It's how you divide up the workload, I guess.
That's right,
What
absolutely.
you do. The ability to talk to a patient, it seems to me, first of all, if you can ascertain what the problem is, if you can diagnose them on the phone, that person doesn't have to come in. They don't have to. Your time is saved by doing that over the phone. There are savings that accrue to all parties, it would seem.
Absolutely. An example I would remember is I had a mother call me, the principal that called with a broken arm for her kid, and she wanted to know which ER. And I said, neither. Why don't you go to get an x-ray, bring it to the office. After about 20 minutes of my time, I had a splint on him, and that was it. No ER, and we were done in about 2 hours.
And the kid, I'm sure, was grateful as a result
Absolutely.
of all that as well. You don't take insurance, and
That's
there's
right.
a reason for that.
Exactly. If you look at your average doctor's office, you'll find multiple clerks for each doctor. We have 3 doctors and a nurse practitioner and 1 clerical worker. And they're there to us medically, to focus on what we can do for patients in medicine.
So in a lot, you've reduced a tremendous amount of overhead if you don't take insurance. You don't have to deal with all the paperwork. You don't have to do the paper chase that goes with something like that. So you can,
and distraction.
And distraction, frankly.
Man.
You can focus on what you're supposed to do, and that is healing. Is this the model for everybody, or is this a part of medical practice that we've forgotten about and we need to move back toward?
I would say both would be my answer. I think it is the way forward. We were talking before we went on air about how California allows insurance agents to keep 30 cents out of every dollar and spend it on non-medical costs. So we want to spend, we want our patients,
staggering amount of money.
It really adds up, and we want our patients to, well, either use us or don't use us. We'll charge you for time, and that is it.
DocTalker. It's a heck of an idea, and I think a lot of people are going to be taking a very close look at it. There's the phone number. If you need a doc, call 703-938-4604. You can actually talk to one. Dr. Steve Simmons, thank you so much.
Thank you for having me.
See you again.